Hey everyone, and welcome. We're here to walk through the new Careclinics Clinical Training Program. Now, I know what you might be thinking, another mandatory course. But this is so much more than that. This is really about sharpening our skills, boosting our expertise, and truly empowering the way we care for our patients. So, let's jump right in.
Everything we do here, it all starts with this one core promise. This training is built on the idea that we're balancing that essential human touch, the care part, with the top-notch medical excellence of our clinics. Getting that balance right is what makes us, well, us.
So here's a quick look at what we're going to cover. We'll start with the big why behind this training, the Careclinics promise. Then we'll break down all 3 modules one by one. And finally, we'll get into all the practical details you'll need to know.
Okay, so let's start with the most important question. Why this training and why now? It's pretty simple, actually. It's about making sure everything we do, day in and day out, connects right back to that Careclinics promise. And just as importantly, it's an investment in you and your professional growth. Our mission here really boils down to 3 things. Number 1, improve the quality of care for our patients. Number 2, make our service delivery even better at every single touchpoint. And number 3, build a team where everyone feels positive, motivated, and totally competent. It's a win for our patients, and it's a huge win for all of us.
All right, let's dive into Module 1. This one is all about mastering the essentials. Think of this as the bedrock, the absolute foundation for providing excellent patient care. It's about making sure we all start from the same strong, consistent place.
Right at the heart of this module is something called the 10S concept. It's a really powerful framework for building trust with our patients. It starts simple, with a warm sunum or smile and a respectful salam, a greeting. Then it moves to being prompt, sagra, offering a reassuring sentu or touch when it's appropriate, always being polite, sapan, and presenting ourselves in a smart, professional way, sagak. These simple steps, when done together, create a truly amazing patient experience.
Module 1 also makes our core roles crystal clear. You can think of it as 2 sides of the same coin. You've got the front-facing counter service, that's our first impression. And then you have the behind-the-scenes clinic management, which is what keeps the whole engine running smoothly.
And of course, this module is packed with practical, hands-on skills. You're going to master core procedures like the 5R concept for dispensing medicine safely, taking vital signs correctly, and even proper clinical waste management. This isn't just theory from a textbook, it's about building real confidence for the tasks you handle every single day.
Next up, Module 2. This is where we shift gears a bit and focus on those high-stakes situations. The goal here is simple: to give every single one of us the confidence and the skills to act quickly and correctly when it truly counts.
We'll be diving deep into 3 absolutely critical areas. First, vaccine cold chain management, because the integrity of our vaccines is completely non-negotiable. Second, emergency trolley management, so that in a crisis, you know exactly what you have and how to use it. And finally, basic life support, the skills that can literally save a life.
So, just take a second and think about it. An emergency is unfolding right in front of you. Things are chaotic. What is the very first thing you should do? This module is designed to give you a clear step-by-step answer.
And that answer is the DRS ABCD algorithm. This is our playbook for any emergency. It's a precise sequence you can rely on. You start with D for danger, is the area safe? Then R for responsiveness, can the patient respond? S is for shout for help. Then you move into the life-saving checks. A for airway, B for breathing, C for circulation and CPR, and finally D for defibrillation. Mastering this flow is absolutely crucial.
Okay, and that brings us to our final module, Module 3. This is all about taking that solid foundation we've built and taking it to the next level. This is where we really focus on your continued growth, introducing more complex procedures to expand your expertise.
Here, you'll get hands-on training in some serious skills that will really expand what you can do. We're talking about everything from mastering injection techniques and setting up an IV drip to performing an ECG and assisting in specialized procedures like a pap smear. This is a fantastic opportunity to grow.
And just to give you a taste of how detailed this training is, let's look at the blood-taking procedure. It's broken down into these exact sequential steps, from the very first step of checking the doctor's order all the way to making sure the patient is comfortable. This focus on process is what ensures both safety and quality every time.
Okay, so we've covered the what and the why. Now let's talk about the how. let's get into the nitty-gritty details of the training program itself so you know exactly what to expect.
First off, you'll be learning from the absolute best. Our program is led by Dr. Azura, our head of clinical governance, Matron Shobna, our clinical governance manager, and Essen Santini, our clinical governance executive. You're in incredibly capable hands.
Here are the key details you need to know. The training runs from 9 a.m. to 5 p.m. It's held monthly on Thursdays at our training center in Rawang. The main language of instruction will be Bahasa Malaysia, and it's going to be a great mix of classroom theory and, most importantly, hands-on practical sessions.
And here's how we'll track your progress. It's a simple 4-step journey. We'll start with a quick pre-training survey just to see where everyone's at. Then you'll attend the training itself. Afterwards, there's a post-training survey to see what we've learned, and it all wraps up with an on-the-job assessment to make sure you're confident applying these skills in the clinic.
So let's be really clear about this. This program is so much more than just a requirement. It truly is an investment. It's an investment in your skills, it's an investment in your confidence, and it's an investment in that shared promise we all make to our patients. And so I'll just leave you with this one final thought to carry with you. As you go through this training, ask yourself, how will you, personally, use these new skills to deliver on our promise of care and make a real difference?